Okay, does the patient feel any pain after the stent is placed?
Okay, look, I'll tell you the things that can happen with the implant and explain the reasons behind them. The first thing that can happen with the implant is that the patient might feel pain in his side during urination. Why is that? Actually, the stent is a tube that carries urine from the kidney to the bladder. So when the bladder is full and we go to urinate, the bladder contracts to expel the urine. This contraction increases the pressure inside the bladder. When this pressure increases, some urine can flow back through the stent toward the kidneys, pressing on the kidney capsule and causing pain during urination. After urination, the urine flows back down and the pain disappears.
It's like a stabbing pain, exactly.
You feel pain that comes and goes during urination, and that's it. The pain goes away afterward. That's the first thing. The second thing is that sometimes the patient feels a constant urge to go to the bathroom. They might say, every time I go, only a small amount of urine comes out, and then soon after, I feel like I need to go again. Sometimes, especially in females, they imagine that they have urinary retention. They go to the bathroom, but no urine comes out, so they feel like they're retaining urine. This happens because the stent is inside the bladder and moves around, which irritates the bladder wall, making it irritable. So the bladder keeps contracting, and these contractions give them the feeling that they need to urinate. We agreed that the stone moves inside the bladder. So this movement inside the bladder causes friction against the mucosa or the inner lining of the bladder. And this inner lining of the bladder is very delicate. Just like we agreed before, it's like the lining inside the mouth. Any bump to it causes pain, especially if the patient is exerting themselves, like going upstairs or walking a lot. So this friction, this rubbing happens. It can make the urine, yes, it can make the urine turn red. And since the bladder is like a balloon filled with water, even a single drop of blood will make all the urine change color. It all turns red. He feels like he's having a hemorrhage, panics, and calls you. So if the patient is careless, these things can easily happen and he won't notice.
He definitely won't notice, of course.
He absolutely won't notice at all. So these things might happen or they might not. Quite simply, they might not happen at all. The patient might not feel anything at all. I had a patient who doubted and asked me, "Doctor, did you even do the operation?" I told him, "Of course I did."
Man.
"Honestly, you wouldn't even feel a stone in your kidney. That's how it is." He said, "I don't feel anything."
Of course, you're not feeling anything at all. That's truly great. Thank God you didn't feel a single thing. I don't know, he was quite surprised by that.
"You could do an x-ray." I told him, "I go and do it."
You don't trust me? You really don't trust me.
Yeah, I told him, "Just thank God that you are not feeling anything serious at all, really."
Now, a question related to the timing of placing the stent or the period during which it was supposed to be placed. You said that there could be 3 side effects that might appear in some people and not in others. For someone who experiences these side effects, do they persist throughout the entire period, or can the body get used to them and things settle down?
First of all, we prescribe medication to reduce these symptoms. For example, we give something called antimuscarinics. This treatment reduces bladder contractions, so it decreases the feeling of frequency, meaning you won't feel the need to go to the bathroom all the time, and these contractions won't be as strong. So you won't get the pain in your side along with the urge. And then over time, these symptoms start to decrease.
They decrease?
So after a week or two, things start to calm down a bit, but it still happens, especially in males.
So, the important question is this. Is removing the stent truly painful, or does it require undergoing the same risky procedure, or is it perhaps a much easier process?
As for removing the stent or taking it out, this procedure is actually, I'm not exaggerating, literally a 30-second operation. We go in through the urethra, locate the stent, grab it with forceps and pull it out. The whole process takes about 50 seconds. It can be done under local anesthesia because it doesn't take long at all, so local anesthesia is enough. But for men, sometimes it can be a bit more difficult unless it's a flexible scope, which is a bit thinner, so it can also be done under local anesthesia. But really, it's not a major operation.
It doesn't need anything, just 30 seconds.
It's a very simple procedure. As for stent insertion or removal, can the patient
Have it just inserted more than once, you know?
If the reason was a stricture in the ureter and we inserted the stent for that, I have to go in through the ureter and check on the condition of that stricture. For example, if there was a stricture in the ureter and we placed a stent and the ureter widened and I placed the stent and left it for, let's say, a month as recommended. When I come to remove the stent, I don't just simply take it out and that's it. No. I go into the ureter to check on the condition of that stricture. How is it now? Has it really widened or is it still narrow? If it's still narrow, and especially if it's very narrow, I have to put in another stent. Before I explain to the patient that they need surgical intervention, because at that point, We've tried to widen it and it didn't work, and it didn't widen. At that point, what we do is go in surgically and perform a procedure called we cut out the affected segment and reconnect the ureter together again. So I can't leave the patient without a stent until we make a decision and prepare them for surgery. I also have to put in another stent until we decide to remove it.
All right.
This is the case where we have to insert the stent twice.
Okay. An important question that I think a lot of people really want to know, does having a stent affect a person's activity, whether at work, walking, or marital relations? Does it impact any of these things?
Not at all. But I always tell the patient, if you happen to notice any blood in your urine, please don't be overly alarmed. You can certainly do whatever you truly want to do, play a vigorous game of football, go out with friends, or simply have a wonderful time. However, at the end of the day, you might potentially find some blood in your urine. Please don't be scared or worried.
Don't be afraid, but also don't cut down or stop doing anything.
Honestly, it's better to avoid it because the issue is that if there's blood in the urine and the blood clots a bit, that can cause some difficulty urinating and create some problems for you. So as much as you can, don't go, my friend, just take it easy. If you're just working out at the gym, that's fine. Don't push yourself too hard. Give yourself a break.
Exactly, just like that. If you notice any blood, it's best to wait until it clears up completely before you resume your activities.
As much as we can, as much as possible. In the end, it's not a big deal, but we'll try to avoid these things as much as we can, just so things don't get worse. All right, a ureteral stent is basically a tube. The tube we use is called a double J stent, which is curved at both ends. We insert it using a guide wire, placing it into the kidney, and once we remove the guide wire, it curls up. That's why we call it a double J stent, or double J. It has a double J shape at both ends. After removing the guide wire, one end coils in the kidney and the other coils in the bladder, so it stays fixed inside the body. So what is a double J? It's a tube.
All right, so what does the patient feel with it?
All right, so in most of the procedures we do with the endoscope, whether for bladder stones or kidney stones, we have to dilate the ureter. We dilate the ureter using serial dilators, sizes 6, 8, 10, and so on, until we reach a certain width that allows us to insert the endoscope. Then we break up the stone with a laser and remove it with a basket. After we finish, we need to place something in the ureter to support it so it doesn't close up again, so that no clots block the ureter, and so that no fragments from the stone we broke up fall and block the ureter. So we have to insert a stent. We place it after almost every or most endoscopic interventions in the ureter or kidney. We might also place it if there's something blocking the ureter, like an obstruction or external pressure on the ureter, which causes urine to back up into the kidney and prevents it from draining properly. In that case, we insert the guide wire into the ureter and place the stent over it to ensure urine can flow from the kidney and relieve the pressure.
So, as I recall, it's mainly to dilate the ureter so that nothing blocks it or narrows it.
We make sure urine flows from the kidney to the bladder.
Could you explain what exactly is the difference between these two things?
What's the difference between a stent and a catheter? The urinary system consists of 1 or 2 kidneys, and from each kidney comes a ureter, so 2 ureters, of course. Then they go down to the bladder, and from there, urine exits through the urethra. The stent is placed inside the ureter between the kidney and the bladder, but the urinary catheter is a tube placed in the urethra. The urinary catheter drains urine from the bladder to the outside.
It just comes straight out.
Exactly, it comes straight out. But the stent stays inside the ureter, not in the urethra. They're 2 different things.
They're 2 different things?
Yes.